So do you want to know something? I didn't know when you put on do not disturb that you don't get anybody's texts. Like it won't even show that you have any texts until you go into your text.
Yeah. Like at night, you don't do.
No, I do. I'm starting to now, but then I go in like half of the day and I'm like, oh my gosh, I didn't even know this person texted me because I forgot to take off my do not disturb.
Okay.
Okay, so uh, really not technologically.
Don't worry. I just was telling Aaron I didn't know that the do not disturb on your phone doesn't disturb you at all. Like you don't even know if people are texting you.
Yeah, I mean, I didn't know that right away either.
I was like,
So,
Aaron, send me the link. Send me the link. And I was
yeah.
like, wait, I forgot.
I think they should rename that to like, we're really not going to disturb you at all.
At all. Yeah.
Okay, so today we have an awesome guest to give us a no nonsense guide to all things injectables and more. And everything, we'll talk through everything from how much people are using to the cost of all these things, how much are recommended for people to use. And of course, we're going to debunk everybody's biggest fears around looking like a cat lady or having a droopy eye. So let's introduce our guest today. Her name is Karen Smith, and she has spent 15 years in healthcare as a physician assistant, not physician's assistant, which we just learned. And her background includes everything from neurosurgery and anesthesia to occupational medicine. And she recently made the transition to aesthetics and is committed to staying at the forefront of advancement with personalized and cutting edge treatment for patients. And I will say she has put needles in my face. So welcome to Lady Party, Karen.
Thank you. So happy to be here.
Yes. Okay. Well, why don't we start with the just like why did you make that transition?
Yeah. Okay. Well, so aesthetics has kind of, as soon as I graduated PA school, I really knew I wanted to work in surgery. That's just where that was the whole plan. And the intensity of it and the demand of the schedule was really quite a lot. And I also knew I wanted to have a family. And so I really love procedures. Love using, like working with my hands, and technical skills are kind of what drives me. So I kind of thought in the background, like maybe I should really consider aesthetics, but I really wanted to hang in with like learning medicine a little bit longer. And then finally, I just was doing occupational medicine, kind of got away from doing procedures and really missed it, but didn't want to go back to the lifestyle of surgery. So I thought, okay, well, I'm going to have to dive in and really learn on my own how to do all this stuff. And so I made the jump, and the goals were really procedures, better life work balance, and more autonomy. And here I am.
That makes sense.
Yeah.
And
Yeah.
so wait, are we like, can we presume then that the life of a, what are you called now? Or
Oh, well, I guess so there's so many ways to describe, like some people would describe themselves as an injector, or you could be an aesthetic provider. I haven't really figured out like what the mainstream term is. So I'm basically a PA in aesthetics.
Yeah.
Okay.
Injector seems pretty aggressive. I think it's like, hey, what are you doing today? I'm going to my injector.
I will inject people.
Yeah, and it's pretty broad. Like injectors can be, it could be a nurse, it could be a PA, it could be an MD. Like it doesn't really give you a lot of information about the background of the person. Yeah, I haven't like stepped into what I think is the most appropriate outside of PA and aesthetics.
It feels like there should be a better, especially for somebody like you who's like, I'm in surgeries and now I'm doing that. Because I've had people put stuff in my face that I was like, what's your background?
Yeah, right. I mean, that's the lack of regulation in this industry that leaves people either assuming tons of experience or questioning it. And that needs more regulation. But I think that's just going to take time because of how popular, like it's exploded in the past 5+ ish years, where before it was kind of like this nuanced, no one really talked about it. Field, and now it's everywhere. So we'll get there. It's just kind of the in between, which leaves patients in the lurch a little bit.
Yeah.
So can I segue into like, okay, well then what does it take to become like an esthetician? Or, I mean, is an esthetician totally different from a PA esthetician? Okay.
Yes.
So like, what's the
that's
requirements?
yeah, really confusing. So estheticians, they range from, you can do certain courses or you can work under somebody who is a trained esthetician. And mostly these people, estheticians, that name means that they treat the skin, the outer layer of the
Got
skin.
it.
So those people are doing facials, dermaplaning, sometimes a really shallow depth of microneedling, waxing, those types of things. And where when you get into the medical side of it, we are using prescription medications to treat. And usually that means injecting it.
And
Okay.
where is like med spa? Is that like a one of the two, or like
So
what?
this is like, yeah, more of the same of the ambiguity that we are not well defined. Usually, if they're using medical in front of the spa, then there is like there should either be an overseeing MD who is a part of that, or in some states, nurse practitioners, because they're using prescribed medications to treat, or only like a device that only can be used by somebody with a credential like an RN or a PA or MD.
Okay, so if we're getting like Botox somewhere, and we're gonna get into what all these things are,
Yeah.
but if we're getting like, is there some kind of qualification we be? Because sometimes like now that like because of the boom, there'll be deals
Oh,
everywhere.
yeah. Right.
So how do we, as like the lay person who wants it but doesn't want to pay $1 million for it, like how do we qualify? Like, is this person qualified, or if they have access to Botox, can we assume that they are?
Right.
No, none of those things. So this is, yeah, it's really tough for the consumer. And I would say the best way to know is the place that you're going. You make the appointment, and you should have the appointment with a provider name. And you can search that provider name and find their credentials, and you can see that they're an RN or a PA, or, they have the correct credentials. Most states, it's regulated so that those are the people who can do it. I'm not 100% sure. I know Texas has a lot of lack of regulation where it could be anyone, like an esthetician, non-medical. So I know it's being worked on, but the only way is just do a quick search on that provider that you're being paired with and just see what their credentials are. And
How do you? Because sometimes you don't even know until you get to the
okay,
prick in your face.
yeah, that's not a great. I don't love that. If that's the way it is, and you're just taking a slot, and then you just show up and whoever that person is, I mean, then the next option is then you research the practice that you're going to and see if they have an overseeing physician, and then they usually should have like an R team where you can see who's injecting. But yeah, that makes it really tough. And I think that most, I don't want to say credible, because then somebody just doesn't have their website set up well, but they should give you a name so that you are informed.
Okay, well, here's my next question then.
That's
So
good advice.
I have definitely bought like Black Friday sale at like the
course.
large mega spa chain
Yeah.
of like, hey, I'm just buying the next year's worth of Botox.
Right. Yeah.
Because it's so inexpensive.
Yeah.
It's at one of those chains that, I think it's actually nationwide, but you never know when you show up there, like who you're gonna get.
Right.
And what I will say, because I have been to those places and I've also been to Karen, is the outcomes are different. And I don't know how to explain why that is. Like, does it matter like where they put it or how they put it in me? How they inject me?
Yeah. Yeah. I mean, I think you could ask 3 different providers that do aesthetic medicine, and they can tell you some nuanced ways that they like to do it. And you're going to get the same outcome from all 3 of them, but they're just changing a little bit. I think big chains like that, they typically have their own training program. So they are going to demonstrate a very specific way on how to do the injections, how much to give in certain places. And it's basically going to be very like cookie cutter. And then I think when you go to more individual, or maybe somebody with more education, they're going to do their own research and try and tailor it to your specific face.
Mm-hmm.
I don't think one is wrong or one is right.
Okay.
I just think, yeah, that's probably why you will notice different outcomes, because you're being a little bit more paid attention to as a human with dynamic movement versus like, this is the pattern I do.
Right.
Oh,
That makes a lot of sense.
And Botox can never be like, when you go to like a luau and it's like drinks are included, but the Mai Tais are all like way watered down.
Yeah, hate
They would
that.
never like they would never like you can't like water down Botox at those places to price it differently or gosh. Oh,
Oh
no.
no.
Yes. So that can be done. I don't know what they're doing. Like, I'm not saying like, yes, they're all doing this but yes, they can do that. But the incentive is really low, I would say, because then people won't come back. So like, if you're getting crap Botox and it's not lasting or it's not doing its job, then that's great. They're like churning out volume. They're offering deals and just people are coming and going. But people will get a bad reputation. It's like, yeah, I'm going to get an $8 a unit thing, but it lasted me 4 weeks or I look crazy. So there's not really an incentive for them to do that to an extent. But yes, you can do that.
Except that they,
So
like,
dangerous though.
yeah, but you also like they have your money at that point. So you're kind of handcuffed to that place because you're like, well, I have all these credits at this place, so I'm going to have to keep going back until at least I use all those.
Right. Yeah, I mean, that's true. I have a hard time thinking there's a lot of money in aesthetics. So yes, people will be driven by it. It's really hard for me to wrap my mind around it because I purely think from a medical standpoint that my number one goal is a patient outcome. And it has to be a good patient outcome. And if it is not, I take full responsibility and ownership of it. And I want to make it right. So to think about it like, let's just do this in volume and like whatever it is, and people will just keep coming. It's like, it's hard for me to grasp that people will do that.
Yeah.
Right. And you're risking your reputation and
Right.
et cetera. Yeah.
Yeah. Terrible. Yeah.
Gosh, wow, you really got two of us thinking. I don't know how many other people y'all thinking too. It's a little, but it's good. I mean, this is all great information to know and get out there because it is so popular now and it's not as taboo, to
Right.
talk about it.
Yeah,
Before,
which is great.
When I remember the first time I just went and got it, I was young, but I was like, ooh, what is this? And I went to my doctor and it was awful. And it was so expensive. This was like so long ago when it first came out. I was like, I have to try this. I think I was like in my like early 30s or like late. I think it was like right at the beginning when I first even heard about it. And granted, I think I did my hot yoga after, and so my eyes were
Sure.
Anyways, I don't know if they were so informed not to tell me to like go do hot yoga and stand on my face. But anyways, one of my eyes were like wonky, and I never did it until like really right before I got married. So anyways, it like totally scarred me.
Yeah.
You are the reason we all now have to like get the instructions post procedure that are like, don't stand on, like, don't bend over for the next 4 hours and don't drink alcohol or go anywhere hot.
Yeah. I did all those. I probably went out and had a drink afterwards. So.
Oh my gosh. Well, you're not alone. I think that is how it's also like, I know that was a while ago, but I think it's become more casual that people don't consider that you had something injected into your face and there are possible side effects and there are things that can go wrong. And so you have to treat it like you've had a medical appointment.
Right.
And
I never have.
I would say most people don't. And no matter how many times I see you, I'm always going to say like, don't remember. And like the 5 points that I always say are like, no intense activity, no heat, no intense heat, sauna, steams are out today, facials, massages, leave that all for 24 hours. And I always do that because those are like the things that are like my absolute deal breakers. Because if you come back to me and you're like, hey, I did this, but then I went to hot yoga and I did all these things, I'll be like, okay, 9 times out of 10, I can fix whatever it is. So it's fine. And we're all human and these things happen. But I need there to be like some awareness of you have a drug injected into you.
Right.
So
yes. I guess.
Be mindful and, go on and be safe. Yeah.
That brings up, okay, we have a list of questions that I promised we were going to get to.
Okay.
Questions that we did not tell Karen we're going to be asking, but we're talking.
I love it. It's great.
So Megan started early 30s. I mean, I hid it from my husband for the first couple of years. I think I was doing it, but I was also probably mid-ish. But you hear about gals that are doing this, and it's probably just not gals, but probably majority gals. But you hear about gals that are doing this in like their 20s.
Yeah.
So what, like, number one, like, do they even have wrinkles? Or is this like, are they using this as their, like, wrinkle removal moisturizer that, like, we're going to prevent wrinkles from starting?
Yeah. Okay, so this is a really tough one because I don't want to diminish that there are very youthful people who have bad genetics. Like they already know, they can see it forming. They see grandma's frown lines already starting and they're like, what can I do about this? But I would say a majority of them are misinformed because of social media. And social media makes it seem like if you're not getting the preventative treatment, you're screwed. These are awesome drugs. I see women in their 50s who've never had it done and they've taken great, they have well hydrated skin, taken great care of it, and they can have completely smooth outcomes. Mm-hmm. That is the point of the drug. It's not so that we are charging people for things that they don't have. It doesn't make any sense to me. Where we live, I don't see a lot of 20-year-olds, but I have a handful of them, or I've seen them as a second person to get an opinion. And I have one patient, I can remember she came in and she had this sheet from one of the big chains that had like 70 plus units on it that she needed. And she was like, I got really overwhelmed and I didn't do it because she's like 26, 27.
Oh gosh.
And I was like, well, what is it that you wanted to treat? Why did you go in there? And it was just this tiny little area. And I said, well, if that's really concerning to you, do you want to just start there? Yeah. We don't need to do this whole crazy thing. And I think it's a lot of misinformation. If you don't do this now, you're screwed forever.
Right.
That's why that's happening. But yes, do you get a lovely glow from having toxin in your face? Yeah, you do.
So. And what is that? What is like, why do they have, I mean, I know that they're on TV and then there's airbrushing and there's like all these now filters and, I've used the filters before too. They're actually really good.
Yeah, they help.
They do. But like, what is it? I mean, I'm sure there's a few different procedures they're getting done, but what is it that they just don't have? Like, you can't even see their pores. They're like, no marionettes, no nothing. Is that filler? Is that microneedling? Is that a combination of Botox or even like facial surgery?
So it's a combination of so many things. Genetics is usually number one.
Okay.
Taking really good care of your skin from early on, protecting it from the sun. That's right up there. Mm-hmm. And then also, the maintenance stuff is super helpful. Microneedling, lasers, keeping your skin really well hydrated. Those are things that will get you the skin type that you're looking for, the even tone, that glass looking skin. It's possible, but not everybody can achieve that. Genetics plays a huge part of that. So I think there's the conception, if you just use these 3 topical products, like you're going to just have this whole new look, which I don't think that's realistic. Yeah, I think that's a lot of salesy fun stuff.
Remember that was like La Mer. Remember that lotion? I know it's still, and everybody was like, oh my gosh, that's what J-Lo uses. Look at
all
her.
over her body. And it's like $500 for a little cup.
Yeah. But I mean, if we go back from like J-Lo on, what was she on? In Living Color?
Yeah, Fly Girl.
She's been gorgeous skin, beautiful forever.
Yeah.
Genetics are helpful.
Mm-hmm.
Yeah.
Okay. Let's go into like what each one is, because I think for anybody listening that doesn't know.
Yeah.
It's intimidating. This world is very...
Oh my gosh. Yes. Yeah.
Okay. So the first kind of category, neurotoxins, which is also called, I now hear them like euphemistically called wrinkle relaxers.
Yes. Yep.
But what is like, that's the Botox.
That's right.
And there's Botox, the brand names are Botox, Dysport.
So they're all brand names. There is no generic because they all have to be FDA approved to be used in the face.
So but Xeomin, the newest one, the XO one? Or
Xeomin is one of the newer ones. Yes. Okay. So there's 5. There's Botox. That's like the OG. It's been around since 2002, I believe. They have the FDA approval for not only just face, certain areas in the face to treat, but all kinds of medical conditions, neurological conditions, hyperhidrosis, which is like excessive sweating. They've gotten FDA approval and spent a lot of money to be covered for all kinds of things. The rest of them realize that the money is in the aesthetics. So when they get FDA approval, they're usually just getting FDA approval for one area in the face, like the 11 lines or forehead treatment or something like that. So it's not necessarily that they're not a brand. They just haven't gotten the same FDA approval for all of the things. Okay, so there's Botox, Dysport, Xeomin, Daxify, Jeuveau, and I think there's one new one coming on the market soon. The name is escaping me, but those are the 5 that we have to work with in the US.
And those are for wrinkles.
Those are mostly for wrinkles. Yeah, I would say all of them. I don't know if Dysport did any FDA approvals for any medical conditions outside of the face. But yeah, I mean, mostly they're to treat wrinkles, or, they can also treat certain skin conditions like rosacea. So yeah.
And why would you pick like Botox versus Xeomin?
Yeah.
Especially when there's a price difference.
Yeah. So this is like getting into the sticky situations of all of this.
Okay.
Some providers will use one and say, this is the one I use because it will last the longest. Or this one is, I'll only use Botox on the 11 lines, but then I use Dysport up here, and I use like different ones for different things. I don't subscribe to that. I think they're all the same class of drug. Yes, different people might respond to different things, just like you would say, I'm an ibuprofen user, or I'm an Aleve user, or it's still the same class of drug. So I don't have a bias towards one or the other. I think they all do their job. Some of them last a teeny bit longer than others, and some people respond better.
And with one or the other.
With one or the other.
Okay. But is it kind of like, can we assume that these pharmaceuticals are in the same kind of camp as pharmaceuticals, where like, are there, like different offices will get like rural Botox charges office A $4 a unit?
Oh, yeah.
And
so the more you use a product, a lot of them are tiered. Botox is one of them. If you are a huge, like, let's say like an Ideal Image or a Skin Spirit in our area, mm-hmm. If they're using a large amount of one neurotoxin, they will likely get a better deal. So, yeah, right. It's like Costco, like you get it in bulk and then you're going to get a better deal. And so there's nothing wrong with that.
No.
Because they all work and do their job. But yes, so that's why they're incentivized to use one over the other, and then they can charge, kind of the going rate, but they're actually, pocketing a little bit more because they get that. Yeah.
Okay, that's interesting. Okay, and then you said the thing about like some will work better for certain people, because I remember one time I got Botox, and then like 6 weeks later I was like, my wrinkles are back. And,
yeah.
And this was my dermatologist at the time, and she was like, oh, well, maybe you're metabolizing it, like your body has gotten used to it.
Right.
I'm paraphrasing her. She probably would use different terms, but basically, like you're metabolizing it fast. Let's try a different brand on you the next.
Mm-hmm.
And yeah. I think I got Dysport because Xeomin wasn't even on the scene, and then that did last longer. But then I just kind of rotate through them now.
Yeah, and there's nothing wrong with that. You can get a different one every time. That's not going to impact anything. There's a thought in the industry about non-responders, or just your ability to respond in the same way diminishes over time if you're using the same product. So a switch up is recommended. I don't have any like data that I'm aware of that supports why that happens. But I do kind of wonder about using the same thing over and over and over again versus you going to different injectors and them not giving you the same amount each time. So if you went to saw someone 1 month and they gave you a certain amount of units or placed it in a certain way, and then you saw a different injector the next time and they did it different, that would be more likely to me the cause of why the duration's not there versus the actual drug.
Okay. Like units wise
and placement.
Right. Placement.
Yeah.
And if you've done hot yoga immediately.
Yeah. Hot yoga immediately it could.
You get a lazy eye.
Well, yeah. While drinking cardamom. Yeah. Okay. So, but here's another question then. Okay. So that's on the wrinkle relaxer side. Well, let me ask you, I know every face is different. But is there kind of a standard range? Like when you see a woman in her mid 30s to mid 40s, like is there kind of like, yeah, she's probably going to be a 30 to 40 unit gal?
Do you think I walk around doing that to people?
I feel like I kind of would. I'd be like, ooh, we got a 50 here.
I see her and I'm going to be like, what about her?
Yeah. Oh my gosh. It's tough when I see people, mainly because I don't know if like, what if they just got their tox done like 4 weeks ago? They're going to be like primed. I don't know. I have to be able to see their muscles out like in movement and without having anything really in their face to say like authentically, like, I think in order to treat that, you need X amount. Yeah. So that's why, luckily, gosh, that would be so consuming.
That's funny.
I've never been to a place where they recommended more than like, I think like 40 and it's graduating higher.
Yes, of course.
I get.
Yeah.
So I'm like a 35 to 45 unit gal.
Sure.
No.
Yeah, I think there's a mainstay of like the general population who gets this done is usually between 30 and 50. Yes, but specifically, I won't be able to know that until I see you doing all the moves and then figuring out what is best.
Yeah, because that's why I'm like, what? When that, the 26-year-old talking about that she was recommended 70. Like,
it's crazy.
That's an insane amount.
Yeah, I agree. So, I mean, that's why you have to be kind of careful. But at the same time, that was my follow-up question is, well, what area did you want to treat? Because they have a full face down the neck full of tox, which if, you don't have to really do all of that at that age.
What do you mean down?
And she didn't. Oh, like the platysma bands. The platysma bands, sometimes they will treat down the platysma band so that when you do this, you don't get these necklines.
Oh.
Yeah.
At 20, it relaxes.
Did she? No, not at all.
That's frustrating.
Yeah, it is frustrating. And I think that's really wise. That was very wise of her to say, I'm going to go get this reevaluated somewhere else, because I don't think people think of this area as like where they would get us. And at most surgeries, like you should, super wise to get another consultation and check and see what another surgeon says. This is not that unsimilar. It's your face. And yes, it's only 3 months of your life. It's not forever. But you never know. If it feels wrong to you, you should get a second opinion.
Yeah. Okay.
It makes a lot of sense. I mean, you're getting it in your face. I mean, I don't know. It just seems pretty important.
And some people roll with that better. They're like, I don't really care what happens. It's fine. It's temporary. And some people are like, this has been the worst 6 weeks of my life,
Oh, that's horrible.
So it's tough.
Yeah.
I will share just a personal story. So especially for people like me who are kind of hiding it from everybody, because I was like, I want it, but I don't want anybody to know I got it.
Sure. Yeah.
So, and all those fears are like cranking through. Yeah, I'm like, what if like they injected into my brain and now I die on the way home?
Oh my gosh. Yeah. Terrible.
But it was more so about like, number one, how am I going to pay for this without my husband knowing?
Yeah.
So I actually stole the money out of our, our go bag in case there's ever an emergency.
Oh my gosh, Erin.
Put cash in there, and I just stole that and paid for Botox. But
nice. Okay.
I put it back eventually.
And it was an emergency.
Yes, it was. I was more worried about like any twitch in my eye region, or I was like, oh God, it's coming. Lazy eye, it's coming. Like I was petrified for the couple of weeks I had it.
Yeah.
And then like if they don't do it right, that's how I had to learn. Like I can't have it too low on my on my brow line, because then I get
heavy.
Brownie.
It doesn't look like I've had a stroke, but it's like I can feel it, and I feel like I'm having to fight my eye.
Right. Yeah. Yeah. I think that is a really good point to bring up too, is especially for new faces to me. And I always tell people I am probably going to go lighter than whoever did it last, because I have to learn your face. And the last thing I want to do is sink you or make you too frozen or all the things that I can't undo for the next 3 months. Mm-hmm. So I'd much rather you come back in 2 weeks and say, I have too much movement, than I can't lift my eyebrows up at all.
Right. Because the cost is going to be the same too, right? I mean, you're just doing a little bit to get
the cost will probably change. The cost will probably change. And then that's kind of the important thing. Like sometimes I can tell somebody needs to be at a higher point, but I'm afraid that their muscle cannot take it. And so I start them low and say, this is where I think you might end up here, but I would rather start at this lower price point and this lower unit point. And then if you're cool with going on this journey, then we can do that in 2 weeks. But
meaning like somebody comes in and you're like, I'm gonna put 40 units in you at whatever, $15 a unit. And
Right.
then in 2 weeks we're coming back and we might need another 15 to 20 units
Right.
at another $15 a unit. But
Yeah.
it's just a phased approach.
Yeah.
Yes.
Right. Phased approach. I love that. I've never thought about that.
Yeah, but it's an evolution.
Yes. Yeah, especially for new faces to me. I think it's the best approach to do. But, the people who come to me and they've been seeing somebody else for 5-10 years, they're like, ugh. Because they're like, I know what I need. Can you just do the thing? And I'm like, no, I don't.
Yeah.
What your injector started you at 5 years ago, it might not be the same anymore. Like, I can't just assume that we're doing the same thing.
Yeah.
So,
Okay. So let's talk about fillers.
okay.
So that's kind of the second category. So like, what is that? Because I always thought it was like, oh, wow, she has like a beautiful face. I thought it was all Botox. And now it's like, no, those like lifted cheekbones, those are fillers.
Right. Yeah. So filler is mostly hyaluronic acid based. I don't actually have any colleagues that I know of that are using non-hyaluronic acid based fillers. It's basically a gel, and they come in different and the way to describe it the best is like the firmness of the gel ranges based on the area of the face that you're treating. So like in a lip, you want something really soft. In a cheek, you might want to mimic bone and have something harder, but it's still hyaluronic acid. And that ranges. I think where we live, super conservative for the most part. When I say I think we should start with 2 syringes or 1 syringe, like people will immediately be like, no. Like, I get so much pushback from it that I am probably one of the small few who just go, okay, well, let's start with a half, and we're gonna be phasing this because.
But what are they worried about, or what are they concerned about?
They are worried about the look that doesn't allow them to blend in with our demographic, like not our demographic, but just our aesthetic on Bainbridge Island.
Yeah,
really.
so for anybody listening, where we live, it's like the Pacific Northwest, and we're known for like granola and crunchy, and this is all
right.
Natural beauty. When we all
everyone on this island has natural beauty.
They were born with it. Everyone's genetics are perfect on Bainbridge Island.
Yeah. And I think that's kind of the biggest thing is they don't want to look like they're living in LA. And if you stick one of us in LA, we look ridiculous. And if you stick someone in LA and you put them here, they look ridiculous. So it's, I get what they're saying. Try to emphasize that my approach is always going to be conservative and we're never going to overdo. The thing about filler is depending on the area that you're treating, like cheeks, I mean, you could easily put 2 syringes on each side of a cheek and barely notice that somebody's had it. But it's really hard because there's a stigma around a syringe. Like you're getting a syringe of filler is like, whoa, you must have like needed a lot of work.
Right. Yeah. Well, and the filler lasts longer, right? So the fillers are longer than the Botox.
Oh yeah. So filler, and it's not real. It's basically it's either hydrating. The purpose of filler is to hydrate or to volumize. So I have older women who come in and they get lip filler, they get a tiny amount, and it's really not because they want big lips, it's because they've lost hydration, estrogen plummets, we lose the hydration, and they want to just have a hydrated lip because hyaluronic acid hydrates. And so I think like the misconception of like, you've moved on to filler, they're 2 different Botox filler, they're completely 2 separate channels of achieving goals.
So do fillers I know you're saying it's hydration, which I haven't really heard much about, like that being the reason why people will do it, but I know that sometimes it will, because if it lifts, then would it be taking away lines a little bit too? Like, is that?
Yeah, that's the other side of it. So the volumizing side of filler, of the goals for filler, is when it does volumize certain areas, yes, we like to start at the top. So most of the time people come in and they're worried about marionette lines, or they're worried about their nasolabial folds. Yeah, and these are all valid concerns. except for if we are going to treat that with filler, we're adding volume to the lower face, which then comes down here. So we really want to start up here. And I think some people get upset about using the word it lifts the face. I think it tents the face so that you kind of have a more taut look up here, which offsets the lower face. Sometimes that achieves the goal of eliminating or softening the lower face, and then you can be done with it. And sometimes it doesn't, and there's other treatments that can be done for the lower face.
I mean, that's where I was like, like I look at my mom who's and beautiful.
I know.
She has like jowls.
Yeah.
And I'm like, I don't want that. But then, this is all this stuff is like a slippery slope because you're like, well, now I don't have wrinkles, but now I have jowls.
Right.
Well, now I don't have wrinkles or jowls, but I have a wrinkly neck, or it's just, it's slippery slopey.
It is. It's really hard. This is why I start with what's the area of your concern. I think you go places and no matter what, they come in and they do a full face assessment and they will throw everything at you of what you need. But it's Pandora's box. If you're upset about that you don't have enough lift on your brow, and that's all you want to treat, well, you're missing the rest of your muscle that contracts your eyes. You can't really treat one area without acknowledging the other. It kind of just, it's one after the other. So I always think about it like tackle the first thing, let people get comfortable, get to a point where they can kind of swallow this is what it will take to get you to what you want, and have the awareness to say what you're asking for is surgical. We can do 1,000 things, but I cannot bring your skin back to your ears. That's not going to happen.
So do you recommend people to then surgeons when they're
Yeah.
Okay.
Because then I can tell right away, this thing that people do, it's a common thing. People will be like, I just want a little bit of this, or I just want this. And I'm like, well, blepharoplasty is probably what you're looking at.
Anybody listening, because this is audio. Karen is literally pulling her back towards her ears and forehead line.
Yeah.
And Aaron and I are pulling our cheeks back by our jaw lines.
Yeah.
Marionettes go away. And
everything's great when you can live like this. But I can't do all of those things without using several different options. And one of those is maybe a surgical option. Yeah.
Okay, so let's talk about some of the biggest fears, because I know we're getting close to time here. But so what do you, when people come in and they're like, am I going to look fake? I think you've talked about that just in terms of you're going to go more conservative.
Mm-hmm.
But what can go really wrong?
Okay. Yeah. So this is a great question. So I have seen several patients who have had filler in the past and are getting more, and they have no idea about one of the biggest things that keeps most aesthetic providers up at night, which is vascular occlusion. And that's from filler. And vascular occlusion is basically when the filler has gotten into blood supply and is blocking it, which blocks oxygen to part of your face. It's a big deal. It can be treated. So it's not it can be treated, but patients need to know what to look for so that they can say, hey, this thing that you told me about is happening. What do we do now? Just treating somebody without this information is chaos to me. I can't imagine someone not being informed about a risk of something that they're doing. So for me, that is the biggest risk that can possibly happen in my world, and side effect. It can be treated. The other thing that people think about, I think, is the go-to of yes, for Botox or a neurotoxin, you've relaxed one eye too much, and then you have kind of a droop of the lid or the brow. I hate those things. They do happen. They mostly can be treated. But to me, those are temporary, non-life-threatening things. So I take them very seriously. I just know if I do nothing, it resolves on its own, no harm done. But the other one for filler, I do nothing, I ignore it. I never tell you what to look for. You never say anything. You lose blood supply to your face or your eye.
What are the symptoms for people to be looking for?
So if you've had filler, what you want to look for is basically, there's a couple different things. Blanching of your skin, which is where it's basically an area of normal skin coloring, and then where you were treated somewhere around there, very white, lack of blood flow. intense pain, you are going to have like maybe that bruised feeling after. But if it just feels like this is like, I can't think about anything else, it's so distracting and painful, that's another red flag to me. So those two things alone are like my big indicators to say like, send me a message, send me a picture.
What about bruising?
So bruising, some people bruise more than others. And I don't really get too caught up on the bruising. If somebody does get something that's like looks off to them, I always just say, no matter what, no second guessing. Don't think about it for a second. Send me a picture. Like, don't lose sleep over any of these things happening to your face. I want to see it. Right. And I don't care if it's, stupid or whatever. It doesn't matter, because I think peace of mind is like part of you having confidence in your treatment. Mm-hmm. So those two things, the whitening of the skin, the intense pain, those are the go-tos. The rest of it, if you have anything else that you're just like, I'm not sure, just send your provider a picture.
Right.
Yeah, there's no reason to worry about these things, but you should be informed.
Which makes the case to having a provider like you, where you could actually like, I'm on a text string with you.
Right.
Versus like the giant chains. I'm like, wouldn't even know, like, how do I send any of that kind of stuff?
Yeah, which that makes that really hard. So that is kind of the crucial thing. Even after a Botox treatment, like, how do I get a hold of you if something happens? I always say, like, the messaging system that you get from me to remind you about your appointment, you can send pictures and text through that. So whatever you need.
Yeah.
Okay. What are the alternatives for all of these things? If you're like, just like, I'm freaking out, I don't want to, I mean, for you, it seems like you do a gradual process, the phase process, which is great for people that are kind of afraid of starting it or looking like a duck or whatever. Right. But is microneedling more of like a alternative to doing filler, or does it make does it last long? What does it do really? Does it just kind of like hydrates and kind of plumps it up for a second and then goes away?
So microneedling is a great way to start and maintain. So it depends. If I have somebody who's like, I've never done anything and I want to get started, my first go-to is always going to be like, let's start treating your skin. Like, let's get you having really healthy skin, see where you come up with, what you look like on the other side of the treatment that I recommend. And then we can see how much of injectables that you need. Because if I optimize your skin health, you might need less or infrequent duration. We can get you to that point. But yes, microneedling is a great way to minimize fine lines. It boosts collagen production, and overall just helps with like some like very light tone pigmentation issues. It can also help with acne. And, as we go through all these hormonal changes, some of us have the not so great outcome of then having like adult acne with it. Microneedling really helps with that. So I always am happy and really like encouraging, without trying to be pushy, to be like, you really want to maintain your skin health. That's, yes, all these injectables are great and they do a great job, but like, the duration of your skin is here to stay. You need that forever.
If you love the episode or learned something, be sure to share it with somebody that needs to know.
We'd love to hear from you. Any topics you want us to cover, send us a message.
And don't forget to come hang with us on Instagram and TikTok. We'll see you next time.